And so New York City is the largest health system in the United States, and it staffs 11 hospitals, so many nursing homes, but they serve everybody, the homeless, the mental health, everyone is served in this. No one is turned away. And so I was assigned to the community, and I was picked as a team leader. And so what we did, there were about 4 hotels that were used as step-down facilities. And so we turned them into facilities. There were floors that were pending COVID test results, COVID positive, and then non-COVID. And these were places that people were going to come out of the hospital and quarantine. And so from the ground up, we had to write all the policies for how this was going to work, because this was the first time this has ever been done. But we did not want to discharge anybody to the streets or back to shelters where they would, if they were COVID positive, that they would infect the people in the shelter. So we wanted them all to come to the hotel, get a room, and then we would provide everything they needed once they got there. We had social work, dietitians, cooks. We took laundry, housekeeping. We took care of everything once they got to the hotel.
How long were you there total?
34 days.
34 days. So how did things evolve over the start of the trip when you were first at that hotel? You were stationed at a hotel, technically, on that community floor?
Community facility.
Community facility. Okay, so the whole hotel has been turned into this community facility. Mm-hmm. So how did things evolve from day 1 when you were there to day 34 when you left?
A lot of changes. There were changes minute to minute, it seemed like. But we just quickly, what we did is there was a night shift and a day shift, and there was 25 nurses on each shift. And so we broke up into teams and we tackled each part of the admission, their stay there. Where can we get supplies from? How is our, only using one elevator for the COVID positive? Making sure we had enough PPE and the policies that we were going to have in place for using that, and having contact with them. And so it was from the ground up, from the time we got our first patient. And we made some mistakes, like our first couple patients were not appropriate. They should have actually gone to nursing homes. We had a gentleman that was like 90 years old, and he fell a couple times. And so it was screening for those potential issues. So because no one's in the room with them, their door is shut for the 14 days that they're there. And then we knock on it to give them their meals and take their temperature.
How did your emotions evolve, and how did the emotions of the other people you were working with evolve over those 30 days that you were there?
When you put 25 nurses together to work on a project from the ground up, at first it was a bit chaotic, and there was a lot of high energy, but once we just knew that we had to scale things down and make subcommittees, so that not every person was in charge with everything, then things very quickly came together. We were working with the top New York Health Department officials in charge of the community that were also there with us. And they were non-clinical though, so they relied on us for our knowledge on how to serve these individuals the best. So things went from a very high energy to finally status quo, where we started putting and pulling things together so that we could serve everyone.
Was there ever a specific point where you felt scared?
No, never.
What were your takeaways?
My takeaway was that there's strength in numbers. When you're adequately staffed to care for the people that are there needing care, you could definitely provide better healthcare. And so they needed us. Those nurses in New York needed us. And so I took away that there's strength in numbers. When you're adequately staffed, you can adequately take care of people. When you have enough of the equipment that you need, because we didn't have enough PPE when we first started. So when you have the things that you need to take care of people, that makes your job easier too.